Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Hay fever. Everything you need to know about allergic rhinitis. Hay fever, officially known as allergic rhinitis, is an allergic reaction to pollen, pet dander, mold, or other allergens. Allergic rhinitis symptoms include sneezing and runny nose, watery eyes, and itchiness. These symptoms happen when your body encounters the allergen, and your immune system mistakenly thinks it's a threat. /r/n/r/n Some people with hay fever experience it as seasonal allergies, like with a pollen allergy, while others have symptoms year-round, whenever they encounter the substance they're allergic to. /r/n/r/nRealPeopleGroup, Getty Imagesrnrn Allergic Rhinitis is the medical term for hay fever. Interestingly, allergies can't actually cause a fever. However, the term hay fever was first used by a doctor in 1819, and it's been common since. /r/n/r/n Hay fever occurs when the body's immune system perceives a harmless substance, such as pollen or pet hair, as a threat. The body then stages an immune response, which triggers hay fever symptoms like sneezing and runny nose. Hay fever is common, more than 1 in 4 American adults experience it. /r/n/r/n Some people experience hay fever seasonally. If you have seasonal allergies, you'll get hay fever when the substance you're allergic to is more common in the environment, like tree pollen in the spring, fire smoke in the summer, and ragweed in the fall. /r/n/r/n Other people have perennial allergic rhinitis, or year-round hay fever. This is usually triggered by substances always present in their environment like dust mites, pet dander, bugs, or mold. /r/n/r/n Hay fever has many causes and can be triggered by indoor or outdoor allergens. That can make it difficult to pinpoint exactly what you're allergic to. Keeping a diary of your symptoms and when they occur might help. Notice whether you experience seasonal allergies or year-round allergic rhinitis. /r/n/r/n The most common triggers of seasonal allergies are spores from plants, including /r/n/r/n Common triggers of perennial allergic rhinitis include /r/n/r/n Some people also experience irritation similar to hay fever in reaction to pollutants or chemicals, including /r/n/r/n This photo contains content that some people may find graphic or disturbing. /r/n/r/n Reproduced with permission from DermNet NZ and Waikato District Health Board. www.dermnetnzorg 2022. /r/n/r/n The most common symptoms of hay fever are sneezing and a runny nose. Some people also experience congestion in their nose and postnasal drip. Other common symptoms include /r/n/r/n These primary symptoms can lead to secondary symptoms and impacts, including /r/n/r/n If you experience symptoms like sneezing, itchy eyes, and a runny nose that come on suddenly, you may be experiencing hay fever. Take note of when and where you experience symptoms, and talk with your healthcare provider about diagnosing hay fever. Remember, although seasonal allergies are common, they are treatable, and you don't need to live with symptoms. /r/n/r/n Collecting the following information can help your healthcare provider make a diagnosis. /r/n/r/n A common cold and hay fever can cause a stuffy, runny nose and sore throat without an actual fever. That can make it difficult to tell the two conditions apart. However, the two conditions do feel slightly different. One way to tell the conditions apart is that a cold can lead to general body aches and pain, which allergies rarely do. On the other hand, itchiness throughout the face, nose, and mouth is common with allergies but not with colds. /r/n/r/n Another hint is how long symptoms last. Colds typically don't last for longer than 2 weeks, but allergies can last as long as you're exposed to the substance you're allergic to. /r/n/r/n Although allergies can be treated with over-the-counter, OTC, medications, you should talk with your healthcare provider if you experience hay fever. Your healthcare provider can make a diagnosis and help create a treatment plan that will work for you. /r/n/r/n Your healthcare provider will first ask about your history of hay fever and when you experience symptoms. To identify what you're allergic to, they'll likely recommend allergy testing. The most common is skin testing, where a small amount of allergen is put onto your skin, to see how your body reacts. In rarer cases, your healthcare provider may order a blood test to confirm your allergy. /r/n/r/n The primary symptoms of hay fever can lead to secondary symptoms and complications. Ear infections, sinus infections, and worsening asthma can all be complications of hay fever, especially if it's chronic. /r/n/r/n In addition, hay fever can lead to poor sleep, irritability, and trouble making decisions. This can impact performance at school or work and leave you at a higher risk of being in an accident. /r/n/r/n Home remedies for allergies play a big role in treating hay fever symptoms. The biggest change is avoiding your allergen when possible. Here's how. /r/n/r/n Over-the-counter medications and prescription medications are very effective at treating hay fever. The medications that are available include /r/n/r/n Immunotherapy, commonly delivered via allergy shots, is a long-term solution for allergies. It introduces the allergen to your body to train your immune system not to react to it. /r/n/r/n Hay fever is a common name for allergic rhinitis, an allergic reaction characterized by sneezing and runny nose, itchy, watery eyes, and a sore throat. You might also know this as seasonal allergies, although some people experience allergies year-round due to dust, pet dander, or other triggers. /r/n/r/n The best way to treat hay fever symptoms is by avoiding the substance that you're allergic to, but that's often easier said than done. Speak with your healthcare provider, who can help create a treatment plan. Remember, although hay fever is very common, you don't have to live with the symptoms. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.